Welcome. My name is Professor Lozier, and today I'm going to be demonstrating for you the placement of an indwelling Foley catheter. So the first thing I'm going to do is I'm going to provide privacy, extremely important for my patient. So we are now in a private setting. I'm going to explain the procedure to my patient at this time and let them know that if they have any significant discomfort, all they need to know is to let me know, and we'll stop the procedure. So the first thing that we're going to do with the patient is let's go ahead and position the patient. So I encourage you, for the purposes of this part of your training, to get the legs spread as wide as you can. We're going to say that this is an Olympic gymnast, okay? And she's extremely flexible. And so I want to have a wide field, a nice wide field to work with. That's going to minimize my risk of potentially contaminating. This leg can come down a little bit lower, especially for those of you who might be smaller and trying to reach over a leg like this might not work for you. And in the real world, that might not be our patient. We might need someone else that's going to help us to hold the legs open. We might have a patient that's contracted. We might have a patient that is on their side and we have to do. That's down the road and with experience, right? We're not going to do that to you. So then all you have to do is verbalize. The first thing I'm going to do is I'm going to do pericare on my patient. This will be there as a prompt for you. We're going to do a nice pericare on our patient, and then we can cover our patient back up. Moving from there, what I'm going to do is I'm going to set up a sterile field. I like my sterile field, or we should have our sterile field. We have a private room that is waist high. And then also, I like my sterile field on my patient to be waist high as well. Because I'm going to move my sterile field, so I want that about waist high, which is where we want to be. Each of the units that you work on will have their standard Foley catheter kit. This is the one, and you'll be able to look at that and see whether or not everything you need is in this kit or not, or whether you need to bring something like a sterile pair of sterile gloves along with you. So this tells us that it's a 12 French, right? A 12 French. All right. It also is going to let us know that there's a balloon in there and a syringe with 10 milliliters of pre-filled sterile water. We want to use the whole syringe. We want to use the whole syringe for adults unless it's contraindicated. Pediatrics is a whole nother bird, right? And a bird of a different feather, and we might not use that entire balloon. But yes, we are going to fill it with that entire 5 milliliters. It's all sterile on the inside here. So I'm going to open up, remove what's sterile on the inside. I like to use a waste basket. Some individuals love to use this as their waste receptacle. That's fine if you want to do that. But what I have seen is once I'm sterile with my sterile gloves and I'm wanting to remove something and throw it away, I've seen too many students hit their hand and actually contaminate their hand. You can put a towel here and put all of your trash on a towel, or using your sterile technique, you can drop whatever you need into the garbage can. But I don't like to use this because I think it sets the student up for failure. Now, what I'm going to do is to take my sterile field and I'm going to move it onto the patient's bed. Hence my strong suggestion that you set up a large area to work with. You got like a football field here to work with on the patient. I'm going to let the patient know that I'm going to begin the process. With this, we always are going to open it up away from us first, right? And take your time to open it up. What I have found, right? What I have found is that if you open it up like two of these that are side by side, like this one is, that works better than if I did opposites. Because if I pull opposite tabs, guess what it wants to do? The other one wants to go boop. So I kind of get my field. I tuck up underneath there, right? I'm going to go side by side, find where we have our other opening. Okay, didn't work so well because that one opposite, you can see. All right, and then I'm going to get my last one and pull this last one out, right? My 1-inch border. See how that one wants to flip over on me? That's why doing it with adjoining sides tends to work best. My 1-inch border, my 1-inch border. I've got my sterile feel. Okay, so let's refresh on sterile feel. Waist high, right? I got my waist high. I don't want to get fluids that are going to leak up underneath on here. I don't want to turn my back, right? And I'll show you when we get our gloves on what I'd like you to do with the gloves. So I'm going to look at my feel. I see I got my sterile gloves on top. Everything else underneath there is sterile. So I'm going to take my sterile gloves. I'm going to have my tray side table where I don't have to have my feel out of my peripheral vision. And we're going to open up our gloves. Say right and left. Sometimes these look great when you open them up. Sometimes they don't look great, and then we will open them up and position them for you if they're all joined together. Same thing with your gloves. Oh, these, wow. These look great. These look great. You get excited about these things. Okay, first glove, and put it on with my dominant hand. Okay, no problem to stay within there. These are going to be tight, but they're doable. I'd rather have them tight than loose. They're going to be tight, but it's doable. Okay, got my first glove on. Second glove, I'm sterile to sterile. I can move this around to where I want it. See where my thumb is. And now I'm going to pinch on the outside, find my opening. Let's see if I can get my thumb in there. Once I get to this part, you want to hitchhike your thumb. You don't want that thumb. All right. Beautiful. All right, now I take my hands and pull them in front of me. Look how I've got an elbow length apart. Can you see that? All right, elbow length apart. You don't want to be pulling a T-Rex on us. All right, no T-Rex. You want elbow length out in front of you. The other thing you don't want to do is this. No one's robbing you, okay? No one's robbing you. You're safe here. All right, I can't see if a fly lands on that or if I hit a curtain, can I? It's in my vision, it's out in front of me, and I like to fold my hands like this. Some people like to do this, whatever works for you. All right, so now, hey, this is going to be good. So I'm going to get we're sterile to sterile. I'm going to get my drape, and there is a shiny side and a non-shiny side. Ideally, you want the shiny side down, but it's not a deal breaker. So now I'm going to fold this back. I'm going to place this without contaminating it. I know I'm going over my field. It's my sterile over my sterile, and drop. You see that? That's all you got to do, okay? If this gets all funky wonky, this isn't a deal breaker. If you need to move it, you can move it. But if not, we'll just avoid it, okay? Don't fail because of your drape. Now we got cool stuff in here. This is for a male or a female. It tends to, maybe for a male, provide a little more privacy. We're not going to use it. Watch what I do. Drop from above my waist off the sterile field. Now I've got these two boxes here. Oh, this is cool. I'm going to move this box and I'm going to drop it on there. Okay, it's what's in the box that's sterile that we need to worry about, not what's underneath. This is perfectly fine. And I'm going to look at some stuff that I have here. Okay, this is cool. All right, I like this. I think what I'm going to do while I have two hands is I'm going to put my syringe that's going to blow up my catheter. I'm going to go ahead and put it on there. Okay, that way it's a lot easier when I have two hands. This is all sterile to sterile at this point. So let's go ahead and put this on. Balloon. it's on. All right. You know what? To make it a little easier, let's go ahead and remove this wrap. Be careful that you're controlling it so that you don't have this go flying and hit something that's not sterile. All right. I'm going to drop out of my way, and let's put this in here so it won't flop out. This is really slick without the sheet on there. It's like a little thing of ice. All right, very good. I like it. All right, I like what I'm seeing right now. Okay, let's open up our swab sticks, which is what we're going to use for cleaning our patient. I'm going to go ahead and take my swab sticks out at this point. I'm going to use them all, or at least take them all out. I'd rather be over clean on my patient than under clean on my patient. This is not a procedure that you're going to want to shortcut. As you recall, 60% of all hospital-acquired infections are related to Foley catheters. 60%. Now, in the real world, what we would do is we would open up our lubricant and squirt it in. So you will do that. We're just pretending, but we don't want to get that goop on these mannequins. And your faculty member is going to, would you mind being my assistant? And just squirt the lubricant right there, please. Nice and gentle, because it'll go flying. Just like that. Okay, all right, good, all right. Wonderful, that was a good job. And you can put it down or whatever you'd like to do. You did your good job. You can relax now. Okay, I'm pretty ready to go now. I'm ready to go. So at this point, I'm going to make a decision as to which of my hands is going to remain sterile and which of my hands is going to become dirty or non-sterile. So I'm going to take the labia, and it's important with the labia that it is a spread and lift. It's a spread and a lift. This is not something you want to shortcut. You need to be able to get the best visualization of the meatus as possible. So I'm going to spread and lift. Now I've got a great shot there, and I can see what I'm doing. At this point, I cannot let go. I cannot let go till it's in and my balloon is inflated. I'm going to take my first swab. I like to go and use them all. I'm going to go on the outside, my labia majora. Labia majora on the outside, and discard out of my way of my sterile field. You don't need to come all the way across your sterile field to drop it. I'm not going to use that area. Labia majora on the outside from top down, all right, and drop out of my field. Now I'm going to go labia minora and drop, labia minora and drop. The last one that I'm going to use, I'm going to go right down the middle, and the meatus can be very hard to find sometimes on a woman anatomically or how big they are. And so when you put this cold, wet cleaning brush on there, whatever you're doing, cleaning tip, it will wink. Oftentimes the meatus will wink. And you got to look for that opening and keep your eye, because anatomically that's going to help. And I'm going to go straight down the middle with my last one. And I saw it. All right, there we go. I'm ready now. Let's not drag this all the way across here. It's sterile to sterile. Why don't we just do this? Why don't we just put that right on top there? Huh? Well, the reason is because we didn't lubricate it yet. So let's lube it. Still sterile to sterile. Lube it, lube it, lube it, lube it. Okay, now we're safe. Always got control of that catheter. Put it on top. Mrs. Jones, could you take a deep breath for me? Okay. All right, take a deep breath. Now blow it slowly. Blow it out slowly. I'm going to insert the catheter until I see urine. Once I see urine, I'm going to go another 1 to 2 inches to make sure it's beyond that bladder sphincter. At this point, I went another 1 to 2 inches. Now I can let go. I'm going to hold on to the catheter so that Mrs. Jones, we're no longer looking at a sterile process now, so I'm safe to do this with my mask. I'm going to hold it because I don't want her to cough it or sneeze it out, okay? Or if we have an agitated patient, my gosh, I got it in there. We said in your lecture, and I'll reinforce it now, that if on your first shot you miss the meatus and it goes into the vagina, or you leave it there, that becomes a landmark for you where you don't want to go, and knowing that you need to go above that. Hey, we're good to go now. I'm going to inflate my balloon. I'm going to use all 10 mLs. Now watch what happens if I let go of my syringe at this point. Watch what happens if I let go of my syringe. What's it doing? It's pulling the fluid back out, isn't it? Oh, well, you don't want that. So, I'm going to fill it. I'm going to test and make sure that it's in there, not yank on it. Oh yeah, that's good. You see that? That's good. Now I'm going to disconnect it. Boom. I'm going to take, and you can place this on your patient. And this we have a stat lock now, which is really nice. Do the stat locks for these, do they go on the tubing or on the, for this one? It looks pretty tight. You kind of weird, isn't it? Oh, that's okay. We'll pretend. So the different stat locks will be with the Foley catheter kit. Thank you, Erlinda. Ladies and gentlemen, that was Erlinda Chess. Thank you. And or a piece of tape will do it as well. Just a piece of tape that's on the inside of the patient's thigh. And then your Foley catheter is going to, your drainage bag. At this point, you're going to have urine coming out. You want to make sure that at this point, from this point on, it is always below the level of the bladder. If we had to get a sterile sample at the same time, oh, I've got a port right here. I can clean that port and get a sterile sample, right? And then of urine for the patient. So what we want to do now with our bag is we put it on an immovable part of the bed. Bed rails are not immovable. The head and the legs are not immovable. On these beds, it's really nice because if you can kind of see this right in the middle here, there's a little hook. Do you see that little hook under there? And that's a perfect place to put it. That's a perfect place to put it. And then I would clean my patient up. I would reposition them. I would let them know that you might feel a little discomfort and pressure in there initially, but that will go away. And then I would leave my patient and I would put it back on, put the sheets back on, etc. The other thing that you'll be doing is removing your Foley catheter as part of the psychomotor process. So what you want to do is come into the room. I've cleaned my hands. I have now clean gloves, not sterile gloves on. I brought in a chucks to put underneath the patient. In fact, there's one already under there. I'm going to explain the procedure. Now I said, oh, I don't want to pull that out while the balloon is inflated. Ouch, ouch. We don't want to do that. And it happens, unfortunately. And sometimes the patients pull it out on their own, and then they buy some time in the hospital because they have a tear. I'm going to get a 10 cc syringe because I need to make sure that I have gotten the balloon completely deflated. So hopefully it was documented that 10 mLs are in there. I'm going to document that I got 10 mLs back. My syringe, my balloon is now deflated. I'm going to ask Mrs. Jones once again to take a deep breath. Some people say bear down. I like to ask them to take a deep breath and then blow it out slowly versus bear down. Mrs. Jones, this is not going to cause you any discomfort. I'm going to pull this out on the count of 3. I'd like you to take a deep breath and blow it out slowly. 1, 2, 3. Deep breath, blow it out slowly. Ma'am, that is it. That is it. Great job. Any catheter that is placed in a patient upon removal of that catheter, whether it's an IV catheter, peripheral, your central venous catheter, your Foley catheter, you always want to make sure that it's intact. It's one of the things you're looking for to see if it is intact. And in this situation, it's intact, and I'm going to document that. I'm going to drain the rest of my urine into my bag, and I'm going to empty the bag. I'm going to measure, and I'm going to document how much was in there when I discontinued the Foley catheter. I'll reposition my patient. I'll have my patient bed in the low position. I'll have my side rails up. I'll have my call light in reach on my patient. Before I leave, I want to let the patient know, Mrs. Jones, it's very important for us the first couple of times that you void after having your catheter removed, that you let us know. So would you do that for us when you feel like you have to void? Just let us know, because sometimes with patients, after they've had a Foley for a while, it's difficult for them to have a natural void at that point. And then I document how the procedure went, how the patient tolerated it, the size catheter, Foley catheter that I put in, the amount of fluid that I inflated into the balloon and removed the balloon, and that's it. And good, thank you.